Now, we all know that there is no vaccine nor cure for Zika. So the best thing we can do is to protect ourselves and our family. It is so important to protect ourselves from these mosquitoes, aside from Zika. According to the World Health Organization, vector-borne diseases account for more than 17% of all infectious diseases, causing more than 1 million deaths annually. That is a very high number of deaths from just mosquitoes. This is why it's very important to protect ourselves from mosquito bites, whether you're protecting yourself from Zika or any other infectious disease that they might carry. It is important to avoid mosquito bites overall. You can do so by wearing loose clothing or long-fitting clothing, just to cover up as much skin as possible. Another thing you can do is invest in insect repellent. There's active ingredients such as DEET, picaridin, IR3535 that will repel the insects. Another thing you can use is permethrin spray, and that's for your clothing, to repel the insects from your clothing. Another thing you can do is you can mosquito-proof your home. You can do so by using screens on your windows and on your doors, in order to prevent mosquitoes from entering your home. You should also empty any containers filled with standing water. The reason being is because mosquitoes can actually breed in standing water. So you want to avoid any containers filled with water because you do not want a mosquito infestation. We also know that the Zika virus can be sexually transmitted without anyone's knowledge. An individual can carry the disease with no symptoms whatsoever. So it is very important to use protection when engaging in sexual activity, especially with a partner who has recently traveled to an area with a Zika outbreak. It is also very important to plan your travel. You should avoid places where contacting Zika is a higher risk, especially for women who are pregnant or for women who are trying to start a family. Lastly, it is very important to know if you have contracted Zika. Reason being is because people donate blood to blood drives and have no clue that they have actually contracted Zika. So there have been some cases where Zika is actually contracted from blood transfusions. Secondary prevention mechanisms include testing and monitoring. It is very important for pregnant women to get tested, especially if they have traveled or they live in an area where Zika is highly active. For those who have already contracted Zika, it is important to monitor the woman or the infant who has already been infected. Tertiary prevention. This is a long-term follow-up. According to the CDC, all infants born to mothers with laboratory evidence of Zika virus infection during pregnancy should receive a comprehensive physical exam, head ultrasound to assess the brain structure, standard newborn hearing assessment, and lab testing for Zika virus, even if no abnormalities are apparent at birth. Controlling the spread of the Zika virus. Healthcare providers should report any Zika cases in order to maintain the spread of the virus. They can do so by registering the mother infected or the infant. According to the CDC, the data collected through the Zika pregnancy and infant registries will provide additional, more comprehensive information to complement notifiable disease case reporting, and it will be used to update recommendations for clinical care to plan for services for pregnant women and families affected by the Zika virus, and to improve prevention of Zika virus infection during pregnancy. This registry provides us with more information about the disease in order to provide better care for those who have already been infected. Women are the most vulnerable to this disease. It affects women who are already pregnant, as well as women who are trying to get pregnant. It is now recommended for women who are planning to start a family to get tested for Zika prior to doing so. Women should take extra precautions in avoiding mosquito bites, traveling to high-risk areas of being infected, as well as using protection and making sure their partner gets tested as well. Who is at risk? Individuals who are currently living in areas where Zika outbreak has occurred, as well as travelers who are traveling to areas where Zika outbreak has occurred, and same with their sex partners. This is why it is important to use protection, because a lot of people that have the disease are not aware of it, so they can easily pass it on to their partners. The best way to avoid this would be to use protection, as well as to get tested. This is very important for women who are trying to get pregnant and who are pregnant. It is also best for them to avoid traveling to areas where the Zika outbreak has occurred.